The polio virus, eradicated from the Gaza Strip 25 years ago, is back. Poor living conditions and the collapse of the health and sanitation systems after 10 months of war have ushered in its return.
Given the conditions of displacement, overcrowding, sewage contamination, lack of clean water, and overcrowding, these are ideal conditions for a very high force of poliovirus transmission, which is transmitted fecal-orally.
The World Health Organization wants to roll out a polio vaccination campaign on August the 17th. The first phase would target about 600,000 children younger than 8, some of the most vulnerable. It's calling for a ceasefire on humanitarian grounds, so its staff can move about safely and unhindered. Israel has rejected similar applications in the past.
Once the vaccines get there, then we need a massive change in the current environment, which is not only ceasefire and peace so that children can be vaccinated, but we also require freedom of movement.
At the end of July, Gaza's health ministry declared the Strip a polio epidemic zone. The health system is already overwhelmed by 1.8 million cases of skin diseases and respiratory infections, on top of other communicable diseases.
We are sounding the alarm, especially after the Israelis have not allowed the entry of vaccines, including the polio vaccine. The virus is present in sewage water. These diseases, especially due to the lack of vaccination of our children, can spread polio.
Israel knows the danger a polio outbreak presents and began immunizing soldiers deployed to Gaza in late July. Before the war, 99% of Palestinians in the territory were vaccinated against polio. And while that figure has dropped slightly to 86%, the WHO says any detection of polio is a public health emergency that could spread well beyond Gaza's borders. Michael Appel, Al Jazeera.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.